Hello and thank you for your interest in JourneyLite. Welcome to our online info session. We will spend the next few minutes talking about our fantastic organization that was founded nearly 20 years ago and is dedicated to fighting the disease of obesity. JourneyLite is comprised of two separate entities, both of which were founded in the early 2000s by Dr. Trace Curry. Dr. Curry felt that having a comprehensive center and an experienced team that worked solely on the disease of obesity would lead to better outcomes for patients. The first organization is the practice known as JourneyLite Physicians. We have 4 locations to serve our patients, including our main base in Cincinnati, as well as Columbus, Dayton, and Northern Kentucky. In addition to our office locations, we have telemedicine options for our out-of-town patients. All 4 locations have experienced healthcare providers and registered dietitians to help our patients succeed. The second organization is JourneyLite Surgery Center, which is housed in the same building as our JourneyLite Physicians main base. JourneyLite was the first outpatient ambulatory surgery center in the United States to be designated as a bariatric surgery comprehensive center of excellence. We are also accredited by the American College of Surgeons and the American Society of Metabolic and Bariatric Surgery. JourneyLite is a very unique facility, as 99% of what we do is either weight loss surgery or weight loss related plastic surgery and body contouring. At JourneyLite, we've published many articles and participated in FDA trials for the lap band, as well as Orbera, Reshape, Obalon, and Spatz gastric balloons. We are most well known for our landmark outpatient gastric sleeve study, published in 2015. This study showed a similar overall complication rate for gastric sleeve, whether the procedure was done on an outpatient basis or inpatient at a hospital. Our experience and results has brought patients from over 30 states for treatment, including Alaska, as well as patients from outside the US such as Egypt, Canada, and Bermuda. Our team experience is extensive, including thousands of gastric sleeves, gastric bands, gastric bypasses, and more than 1,000 gastric balloons. Our center also offers the new SIPS procedure. At JourneyLite, we are constantly evaluating new procedures and technologies to stay on the cutting edge. In addition to JourneyLite, we also perform surgeries at Christ Hospital and Mercy Health Jewish Hospital. Both of these facilities are located in Cincinnati and offer an extensive experience in weight loss surgery. Next, let's take a minute to look at the disease of obesity and how it can impact your health. First of all, obesity is not just extra weight, it's the point at which serious medical conditions can occur as a direct result of this extra weight. Obesity is defined as having a body mass index, or BMI, of 30 to 40. Morbid obesity is defined as a body mass index over 40. This is the point at which your weight can truly become a matter of life and death. BMI is a complicated formula, which is weight in kilograms divided by height in meters squared. It's important to note that BMI is not the same as body fat percentage. Here you can see that obesity can take a toll on your health, even at seemingly lower numbers on the scale. For example, as seen in this slide, a patient who is 5 feet tall would only need to weigh 200 pounds to have a BMI of 40 and be considered morbidly obese. To further illustrate the severity of this disease, studies show that a patient who has a BMI over 40 has a life expectancy that is 7 years shorter than a patient with a normal BMI. Also, mortality ratio more than doubles for a patient with a BMI even over 35. When you consider this information, you can clearly see why obesity is classified as a disease and is not simply a cosmetic issue. Now let's talk about comorbidities. A comorbidity is a disease that is caused or worsened by another disease. With the disease of obesity, the most common comorbidity that we think of is type 2 diabetes. If you eliminate the cause of the diabetes, which is obesity, you may be able to eliminate the diabetes also. Here are some of the more common weight-related comorbidities. If you suffer from any of these, and are obese or morbidly obese, there is a good chance that you'll see improvement, or even resolution of these conditions with weight loss. These are some potentially serious conditions, such as diabetes, hypertension, and sleep apnea. There have been dozens, if not hundreds of studies over the years, that show that all of these issues have an extremely high response rate to weight loss surgery. This makes perfect sense, since they are often caused, or worsened by obesity in the first place. The American Society of Metabolic and Bariatric Surgery has identified nearly 80 medical conditions that are related to excess weight. So why consider weight loss surgery? We have seen that losing the weight will help you lose the comorbidities, yet studies show that only 5% of patients can lose weight without surgery and keep it off in the long run. Simply put, weight loss surgery will vastly increase your odds of keeping the weight off, once and for all.